What is good about the money? Hold the greeting to yourself, madam.
Ogalano, you know it hasn't been easy since Philo went blind. To even afford the meal is a problem.
That is
and you know that Philo was even sent out of school because we can't afford our school fees.
All I want is my money. You people should pay my money or you will back out.
Oga, have conscience now.
Conscience now. And yes,
Oga landlord. Remember we used to pay 6 months in advance for this apartment you are chasing us away from.
That was in the past.
Oga landlord, have we forgotten that you do come and borrow and pay whenever you feel like it?
That was in the past.
Oga landlord, kilo take concept. Have patience. If only I knew how to manage my diabetic condition. This is not happening to me by now.
Diabetes is whereby you're not able to break down your food properly, where there's a missing hormone in your body. The missing hormone is the insulin that is formed in the pancreas. For type 1, they produce little or no insulin at all, where the body does not produce insulin in the body. Type 2, your body is resistant to the insulin, so it doesn't break down your food, and when you eat, it produces energy. So it doesn't break down the glucose to where the energy is supposed to go in the body. So the sugar just stays in the body, hence it makes the blood level rise in the body, whereby insulin is not able to break the glucose. And when we talk about glucose, we're not saying sugar. We're talking about glucose can be from your carbohydrate meals. So it's not basically sugar or cube of sugar you're taking in, or the Coke or the sweet. It could be from your staple food like rice, eba, amala, which we. So once you, as a diabetic, once you eat those kind of food, without the insulin, it will not break the food to be able to pass through your bloodstream where it's supposed to do the work.
So those who are at risk of diabetes are those who have family history of diabetes, meaning if your parents or your siblings have diabetes, you're at risk of having it. Also, those who have polycystic ovarian syndrome, those who are obese, those who engage in sedentary lifestyle, from car to the lift to the office.
The effects of diabetes is not funny at all. You wouldn't want to ply that route. I lost 2 babies to stillbirth during my journey of being diagnosed as a diabetic patient. My first daughter is 18, the second is 10 years old. So during that journey was my 8-year journey, from gestational diabetes to being diagnosed as a type 2 diabetic patient. So you wouldn't want to go that route at all.
As a fertility doctor and a medical officer, I encounter diabetic patients with fertility issues and other major and minor complications on a daily basis. However, laying emphasis on the fertility issues, my patient could present with a lot of complications and a lot of risk factors that could prevent them from getting pregnancy. One of them might be inability for them to sustain pregnancy to term. Most of them usually have an irregular menstrual period. Moving on to the male side, the major problem has to be the inability to sustain erection, or when they have irregularity in their sperm parameters.
I was diagnosed with diabetes 14 years ago. I've always known my mother has diabetes, but I did not have the knowledge to know that diabetes can be hereditary.
All I knew was that my mom was diabetic from childhood. I knew my mom was diabetic since the age of 30 something. Since when I knew her, I knew she had been diabetic. But as her child, I didn't have any knowledge or idea that I needed to check myself.
As a nurse, I've had to care for patients with diabetes at different occasions, and I've seen the effect of the various complications of diabetes on the patient and also on their family. This has so much impacted on the quality of life and also the financial power.
As a medical radiographer, I have patients brought in with diabetic mellitus foot syndrome, which is one of the more common complications of diabetes. Now, this has an effect on the patient and their family members because there's a possibility of amputation of the leg in cases when it can't be managed. This leads them to go into serious psychological problems as well as financial problems and a host of other things. All this could be avoided if people paid more attention to knowledge about diabetes as well as management.
I see patients who have a lot of dental infections, facial space infections, and these conditions are really terrible. Most especially when they have diabetes, it goes a real long way. The infection is difficult to manage, it spreads so fast, and in some cases it kills the patient.
Exercise, it's a physical activity. It helps to allow the insulin in the body to metabolize sugar more effectively. Exercise like walking, jogging, swimming, skipping has a whole lot to do in diabetes management.
Managing diabetes is a lot of work. From the day one that I was diagnosed till now, you need to understand self-management. You need to have the right tools to monitor your blood sugar and your diet.
Managem is a unique tool in the prevention and management of diabetes.
When I discovered Managem, I realized that there was a section whereby I could just type in my numbers. I can type in my drugs, the latest one that I've been given, and then you just click on medication and it just brings out all your drugs for you. It can actually tell you the calories of the food that you're actually taking. For the exercise part, it gives you different types of exercise that you can actually work out on.
It helps with education of patients on possible myths busters that people have about diabetes. It helps you to manage your diabetes for people who have diabetes problems.
And also to help people with family history of diabetes and those particular about living an healthy lifestyle keep an eye on their blood sugar.
For the non-diabetic patient, this app can also help in a way of educating them when they will know at risk. It also help them in a way where they exercise, and which can give them more body metabolic rate, which can make them not prone to diabetes mellitus. So this app has been the most helpful to all my patients.
Managem is a friend. It keeps all the history of your health and your medications. Choose Managem so you can manage your situation.
Download Managem from your Google Play or App Store. Talk to your doctor about diabetes today. This message is brought to you by Self Healthcare Empowerment Initiative.